Health presents Wellness Wednesday from Henry Ford at Home Care. We welcome Branch Manager Leslie Johnston and Nursing Administrator, Patient Care Continuum, Carrie Johnson. Welcome to the show.
Thank you. Thank you for having us.
Thanks for coming in and thanks for your service, both nurses, your healthcare heroes.
Thank you. We are, and we support a team that are healthcare heroes.
Yeah, so, during the pandemic, we had a lot of, focus on healthcare folks being real heroes, and it's not just during the pandemic, it's all the time. Mm-hmm. So thanks for all your service.
Absolutely.
We're talking today about home care, and some might not be familiar with even what that term is. What is home care, and how does it work here at Henry Ford Jackson Hospital?
Perfect. So home care is a service, if a patient qualifies, where we can have nursing, different therapies, social work, home health aides go actually into the patient's homes and provide services.
Now you have quite the background in healthcare. You've been a nurse.
Correct.
You've done home care yourself.
Correct.
And you worked EMS for more than 2 decades?
Yes.
Wow.
Yeah.
So how did you get from where you were to where you are?
Oh, goodness. I started off as an EMT in EMS. I worked for JCA locally here for a few years.
Did you drive the ambulance?
I did.
Oh.
I did. Rode in the back, drove. And really, I loved the trauma and wanted more. And had the desire of a flight nurse. So to do that, I had to go back and get my nursing license. And so became a nurse, worked in an ER.
Did you go in a helicopter?
I've done ride-alongs, but never worked as a flight nurse. So never quite made it to that end goal, but fell in love with trauma, nursing, then emergency nursing. Did a little bit in ICU, but the real care happens in the patient's homes when you can actually see their environment and what they have to live with and work with on a daily basis. So that's where I've landed.
So you love trauma. Mm-hmm. Do you love drama?
No.
Spoken like a true nurse.
So what makes, because it sounds like, going back to the 1800s where all care was in the home, what makes home care such an important part of healthcare today?
I think it truly gives us an accurate depiction of what the patient deals with at home. We can see the distance from maybe their bedroom to their bathroom, as where in the hospital it's very close. So they might need more safety accommodations in the home to be able to remain in the home. And so it gives us a better picture of that.
I would imagine too that, Carrie, people that leave the hospital or leave the doctor's office, there's a lot of things that they're not remembering.
Correct.
They get home and they're not maybe doing the things that are going to heal them properly.
I'm really glad you brought that up. That is very true, and we see that every day because we work so closely with the hospital and our primary care offices. The patient responses in that controlled setting is much different than what Leslie's team sees in the home, and that really is the truest depiction of our community. So not only do we see the physical environment, but we see the dynamics within the family, any food instabilities or nutritional needs, safety needs, social needs. So the work that is done in the home is tremendous.
And do you interact with the family? Is there a situation where you say, look, don't let her climb those stairs?
We will definitely make recommendations to safety at food choices and different things. It's really outside of our hands, but we do make recommendations, absolutely, to family. And family support is also a big key in our success.
Yeah. And I would say it probably gives the family a sense of, it shows the sense of gravity that the patient is experiencing. It's a serious thing.
Absolutely.
It is.
Can you give us some examples of types of services that the home care team provides?
Oh, so we can do a lot of the same services that are provided in the hospital. So we have wound care. Some of them are complex wounds. We can do Foley catheter care, urinary catheter care. We do a lot of education on disease process, education on medications, how often to take them, when to take them, therapy services, physical therapy, occupational therapy, social work, home health aides for personal bathing if they need assistance with that temporarily.
And there's all this stuff that is unfamiliar to someone. I remember like doing just COVID tests at home. It's like cracking this and measuring. It's a lot.
Yeah.
There's a lot of education that occurs in the home, not just with the patient, but with the caregivers, the family. And so that's part of our role as well, is really establishing that bond and that link of education to make sure that the patient is successful.
Who's eligible to receive home care, and how do typically patients get a referral?
So referrals will come from their primary care provider or specialist, or if they were admitted into the hospital, they can be discharged with a home care referral. There are a few qualifications, so it's not available to everyone being discharged, but that's, yeah.
And there probably are clinicians, providers that will say, we got to talk about this person. They're not going to be successful in their recovery if we don't do something.
Correct.
Correct. And a key piece to that, we also offer home care after a skilled nursing facility discharge.
Oh, really?
So many patients who discharge from the hospital directly into a skilled nursing facility for rehab will need home care after that. So then we will step in and support that as well.
Yeah.
What areas geographically or communities does your team serve?
Oh, so we serve to the north, we go as far as the Mason Holt area. To the east, we go as far as Chelsea. South, we go down to the Michigan-Ohio border. And then we go as far west as Marshall.
Is home care an alternative to sticking around the hospital for a few more days?
It definitely can be, yes.
Yeah. So that would be, well, it could be saving money for someone.
True, and best practice now shows that patients do better recovering in the home than in the hospital. So when you asked how is this applicable to now, the healthcare world in 2025, the push is to recover in the home instead of going to perhaps a skilled nursing facility or increased length of stay in the hospital.
Yeah, someone's not poking them at 3 a.m. to
Correct.
take their vitals.
Yes, you sleep better in your own bed than you do in the hospital bed. So,
Yeah.
Recovery happens when you sleep. And so we like to promote that.
That makes a lot of sense. Is it just you? Is there a team?
Oh,
have a
there's a
huge
large
team.
team.
Oh,
Yes,
wow.
yes.
How
We
big?
have
Who else?
branch manager, 2 supervisors. We have a whole intake team that will facilitate phone calls and scheduling. And then, of course, as Leslie mentioned, physical therapist, occupational therapist, RNs, LPNs, social work.
Yeah. Quality educators in the background to ensure that we're providing best practice for our patients and families that we serve in the community.
And it's something a patient chooses. It's not
Correct.
mandatory or.
Correct.
How does if someone watching today thinks home care might be right for them or their loved one, how do they get started?
Well, I would say reach out to a provider, whether that's their specialist or a family physician, and inquire, do they meet the qualifications, and express the need or the request for home care services.
Awesome. I bet a lot of people never even knew this existed.
We're here to serve.
It's great to know we have it right here in Jackson. And it's great to have both of you with us on our show today.
Thank you.
Thank you.
Yeah, and welcome back to Carrie. Carrie Johnson's been with us before. Carrie's nursing administrator, patient care continuum at Henry Ford Jackson. And Leslie Johnston is branch manager from Home Health, joining us here today, this week, on Wellness Wednesday, presented by Henry Ford Health.
Henry Ford.
Thanks so much.
Thank you.